A cataract is a clouding of the lens within your eye. The lens is part of the eye which focuses the images on the back of the eye or the retina. And cataracts develop normally because of age, but in some people they can develop because of genetics or because of steroid drops or medications, dehydration, and also ultraviolet light. How do you know that you've got a cataract? Well, sometimes you don't know, but what happens is you start getting very bright lights and putting them behind you to see if you can increase the light on the page. That's one of the things that you first start doing. Or you might find at night when you're walking down the street or going into a cinema that things are cloudy or darker than they used to be. Or that when you're looking at the television, you sometimes get double vision, so you might get sort of doubling up of letters. Not so much when you're reading, but more when you're looking into the distance. Most people, when they come to the hospital, they will speak to the eye surgeon. The eye surgeon will talk to them about the type of lens that you can have replaced. So, because what we're doing when we do the cataract operation is taking the lens out, and then we replace it with a new lens. Now that new lens is made out of very durable plastic. It lasts your whole life. It doesn't need to be replaced, and it's not going to fall out of your eye. It goes through a very, very tiny incision, 2.5 millimeters, and when it goes into your eye, it stays there permanently. But obviously you want to discuss with the surgeon before your operation what type of lens you're going to have inserted. Now, most people go for a plain lens. That means correcting for the distance. But there are other options. Some people have one eye made for distance and one eye made for near. That's got a term monovision. It's quite complex, but your surgeon will be able to explain to you this in detail. What are the potential risks of the cataract surgery? So the potential risks of the cataract surgery are actually very small. The main risk of any surgery, as surgeons will tell you, is actually not the surgery, it's the anaesthetic. And because most of our operations are done under topical, which means just drops, not even injections, you have got no risk from a general anaesthetic. Talking about the recovery time from surgery, the recovery time from surgery is very, very rapid. In general, on the way home from your surgery, you'll be able to see almost immediately. And the next day, when you wake up, your eye will be a bit blurry because you have to clean your eye. But the next day, you may well be able to drive your car.